Good afternoon, everyone. My name is Shantanu Shao, and today I'm going to present you my work, that is my project regarding the uh, AI product generator, a healthcare platform which can be utilized by healthcare professionals, businessmen, doctors, etc. Now, I chose this topic, that is breast cancer. Now there are a lot of cancer cases in our India, right? And the maximum, I can say, the higher rate or number of cases is the breast cancer, which is basically in the females, right? So my project is somewhere around in that category, in that sector specifically, targeting that audience. Okay, so first of all, so my main thing is that it is breast cancer management system, right? So you will get to know what is breast cancer management system. So let's move on with the first part. This is the I can say the security protocol. So this security protocol I have made because it should be used by the respective personnels or authorities only, not a random person, right? Because it's, as you all know, ki hospitals have a very strict rule regarding the data and information sharing, and no confidential data are shared under the Indian Medical Act, right? So considering that, lot of things I have included here, so this is one of them. So let's move on with the username. So I am giving a admin, this is the password, and this is the administrator, right? You can choose any one of them, there is no issue. Doctor, then here I can write it as doctor, here I can change the password, but let it be admin, right? So I have done here the login. So as you can see, this is the home page, and this is the symbol breast cancer management system, and you will get to know what is this breast. So this here it is the welcome admin. Now I am telling you what it is. AI powered breast cancer management system. This platform helps hospitals manage breast cancer patients efficiently using AI analytics and smart reporting. So this is all about my project revolving here, right? So as you can see here, it is the admin and their role. Here it is the user profile, their last login time. You can see here it is given, and this is the role. Here it is the AI powered breast cancer management system part, right? This is the quick analytics part. This is the system status, and these are the features you're gonna find here in my this web application, right? So you can see here, this is the system status. This means everything is working correctly. Authentication, as you already saw in the first step, it is working correctly. Then this AI part will also come in that, and after that this database part is also correcting correctly. So you can see all system modules are functioning normally. That means whatever integrations or whatever configurations within this web application I have integrated, all are working efficiently and normally. There is no issue with that, right? And here it is the recent activity part. So you can see these two parts are already there, and this thing is already there. So let's move on to the next part. Okay, so this is was all about my home page, right? So this is the navigation bar, I can say, and this is the notification bar. It is already written here, system is running normally, everything is okay, right? And this is the logout button. So once everything is finished, we will log out. But for time being now, let's move on with this control panel, that is the navigation bar. So here is it is the register patient, right? So let's say I'm registering a patient, a random patient I'm registering here. Let's say a patient is having something, it's P006, right? I'm doing not 6, 5. Let's it be 5. I'm doing it to 5. Let's be the name. I can say it as uh, Priya Sharma. So you can see Priya uh, Priya Sharma, right? So let's be a very okay with the age. So let her age be, I guess, say, let's say it should be 35. Let it be 35. Present age. So basically, yeah, she's. You can see two options are provided here, male and female. So I know both happens, but this BCS part, that is the breast cancer part, is basically majorly found in the women. So I will give you a woman only. Okay, you can give male also. There is no issue, but my project is, inclined to them, so I am selecting that gender. And this is West Bengal. There are a lot of other cities are there, but I am selecting, let's say, West Bengal, the hospital name. So here we are having some hospitals, so I am giving a hospital name. Let it be AIMS, right? Let it be AIMS. Now you can choose the blood group here, right? You can choose the blood group. So let it be, let's say, B positive. Now body mass index, you can give, basically this is a model, a prototype I'm showing you here, right? And I know that body mass index matters here, so let's give body mass index somewhere around 24, I guess. Let it be 25. Let's say let it be 25. Okay, so our this first section is completed, personal information. Now moving on to the medical history part. So age at diagnosis, let's say her diagnosis was done at the age 45. Let's say her diagnosis was done at the age of 45. She is not having any family history, means no this kind of cancer history is there in her family. Smoking status, it can be anything, but let it be, I am giving here it is former. Alcohol consumption, I am giving here, let it be low. And menstrual status, I'm giving it is premenopausal, right? And first childbirth, I will say it was at the age of 28, I can say, right? Her breastfeeding history is there already. Apart from that, we'll also see here this tumor and diagnosis part. So we are finished with this section 2 medical history, right? This is basically, see, I am putting a random thing, but actually, see, I am showing you the prototype or the model, how it works, right? This is basically a demo. Okay, basically what things are there, it is there, but I am just showing you the demo, how you can predict by entering these parameters. Now here, tumor and diagnosis section 3. So let I should select ductal carnosis. This is the one. Grade 2 I am selecting here. Right. Now you can give any classification TNM. Right. But for the time being now, I am entering T2N 1M0. Okay. And this is the hormonal receptor status. So let's say I am selecting here this thing. Okay. And this is the, I am keeping as positive this genetic markers. And tumor level, I am, let's say I am making it 22. Yeah. So we are finished with the section 3 tumor and diagnosis part. Now comes your section 4, that is the treatment and screening part. So chemotherapy, you can say, yeah, it was ongoing. I am just putting a random data here, right, to just show you the demo how this web application works. So let's say it is not started yet. Okay, hormonal therapy, let's say it is ongoing. Surgery, let it be BCS, right? Response treatment, let it be progressive disease. Then mammogram part, so last mammogram I am giving it as 15. Ultrasound I am giving it as let's say 18. And this wait, yeah, I am giving it as 3, the MRI. Okay, and apart from this, the screening history, so it is her occasional screening, let's say. And you can give any medications, what medications she's having presently right now. So you can have any one of them, you can prescribe anything, but I am giving here at a random, just the basic I am giving here. I am giving it as calcium, a calcium supplement. You can give any one, but I have, for the time being now, I'm giving a calcium supplement. Okay, so you are finished with this section 4 part. Now moving on to this last section, that is the additional clinical information. So whether she is having any kind of allergy or not. So let's say I'm giving a, let's say, uh, peanuts. I'm giving a peanuts and referral. Let's say, yeah, I have means nutritionist it is recommended. So let's give it here. Now I will click on this register patient. So it will generate the prediction what kind of breast cancer she may develop, right? So yeah, as you can see here, this is the predicted stage. That means she may develop stage 3 breast cancer, which is very fatal, I can say, right? So this is the stage 3 they have done the prediction. Now what thing you can do, you can download the prediction report also as per your further convenience. Means this thing can be used by the doctors, professionals and other people also for their benefit as well as for their information. So let's click on this. You can see it has generated. Now I'm clicking on this. You here you can see this thing, the whole information it is generated, right? And don't be confused with this time, it is showing here the login time. Okay, so don't get confused with this. Okay, so here is the patient information. You can see here the whole medical history it is being given here, right? So this is actual the thing looks like when the report is generated, right? So apart from this, see, as you know, it is already generated the report. Now you will see the search patient. Once the patient is registered, it is registered, there is no problem in that and nothing will go in vain. Okay, so you can go for search pencil. Let's say if someone wants to access the information of the patient, they don't know. Let's say I am putting here it is uh, p uh, p001. I have given it the patient id. See, this patient is already registered here, right? And if you click on this delete patient, the record will be deleted, right? And update patient means this record will be updated in that, in the database, right? Once you click on this, so here you can see here this thing is there. Apart from that, let's go for now which we have registered just now. Let's go for p5. See, just now we have registered here, you can check. So this is the search patient. If anyone wants to access the information, they can access, whether it's a doctor, it's a nurse or a compounder or whatever, whoever it is from the medical industry or healthcare professional, right? Now moving on to the dashboard part. So we have finished with the registered patient and search patient. Now moving on to dashboard part. See, here you can see 3 patients are being registered here and all 3 are female. See, the average is 38.33. So this is the average of 3 patients, you can see here, right? So gender distribution, it is totally female, so this is 100. If it is male, then it will show some kind of difference here, right? Because this is fully it is male, that's why it is showing 100%. Let's say if male people are there here, then you will see the difference in this pie chart, right? But time for timing now I have kept it as female. You can see hospital wise patient distribution. So 3 patients were registered in this hospital, that is the AIMS hospital. So 3 it is given, you can see in this bar chart, bar graph. Okay, this is the state wise, all the 3 patients are from West Bengal. So you can see the 3 patients are from West Bengal, it is showing in the bar chart. Age distribution, you can see, as I told you just now, ki patients are of different ages. So one patient lies in this age group and another patient lies in the age group of 35 to 40, right? And another patient is of 50 age group. See, you can see here age 51 patient is there, and age 35 one patient is there, and age 30 one patient is there. So you can see ki, if you ask me that yeah, what kind of patients are there, so from 30 years to 40 years timeline category, two patients are there, if you ask me, right? Age gap or timeline. Apart from this is the tumor grade. See, as I told you, the grade 2 people are two. See, it is showing here tumor grade 2 patients. So grade 2 are having two patients are having grade 2 distribution, and one patient is having grade 1 tumor. That is the size of the tumor cell or the breast cancer cell, right? Apart from this, yeah, now you can see this. As I told you, this is the treatment response analysis chart, pie chart. So what kind of responses was there after having the treatment, as we already uh, given in the registered, that is the application. So here you can see this is the whole thing. One is having progressive response, that is progressive disease. One is having partial response, and one is having stable disease. So this is the treatment response analysis of three different patients and their percentage you can see. So here it is showing here, right? And this is the histological type. So all the three patients are having this ductal carcinoma and C2, right? So this histological type is given here. And hormonal receptor status, as I already told you. So two patients are having this HER plus 2, right? ER plus, and one patient is having ER minus, and at last HER 2 plus. So you can understand by the pie chart and the diagram. Okay. So here we have finished with this part, I hope. And this prediction report is nothing but previously which I have shown you, right? So this is that thing only. Now comes here the most exciting part and the most I can say the trending part, and the upgraded part is that this AI assistant. So you can ask anything to this AI. Let's say I'm asking here what is, wait, let's say I'm asking here what is breast cancer. So I have typed here what is breast cancer. Now the AI will tell me. Yeah, you can see here clearly it has told what is breast cancer. It happens when some cells in the breast grow, multiply too quickly, forming a tumor. There are two types of main of invasive breast cancer, non-invasive breast cancer, also called as ductal carcinoma and C2. And you can see everything is been explained crystal clear and in a very detail-oriented format, right? And they have also told how the breast cancer can be caused, factors causing breast cancer, family history, age, radiation, these lifestyle choices, etc. Symptoms, what symptoms can be experienced, or what symptoms are there when someone faces this. You can see here new lump or thickening in the breast, a change in the size of the cells of breast, dimpling and pickening of the skin, redness and scalings of the skin in the position inverted, and any of the thing is being there, then simply you can consult to a doctor, right? And have the information regarding that. You can search anything in this AI assistant, right? But one new thing is that if somewhere something is out of context, not related to medical history, this AI assistant will not show anything related to that, right? It will only show something which is related to medical history. So this is something a very, I can say, specific or specialization or domain oriented, right? So this will not show any useless thing, right? It all depends on the prompt, but it will only show what it is all about regarding the medical thing, right? So you can type here anything. Let's say I can type here, let's say So I've given here the prompt. Now let's clear chat this and ask AI about this. Yeah, as I told you, you can ask anything to this AI, right? You can ask anything. I have asked this about this, but one thing I'm telling you, let's say if something is out of context, it will not generate any result. It will simply tell you that I will not generate this because this is something totally different, right? So you have got the full database here, the I can say the details, whatever it is there here, right? Okay, what kind of things should be there and what not. Now let's clear chat this, and now I am asking it a very different kind of a question. Let's say I am asking what is Python. Now see what response it generates, because it is totally out of the context, right? It is not related to medical firm. Okay, so let's see, this is out of context question, what is Python. Now let's see what it generates. So as you can see, this is totally out of context. So see what is out of, can see I am a breast cancer assistant and I won't have information about Python as it is not related to breast cancer or medicine. However, I can tell you that Python might be referring to a type of snake, but it is also a programming language. If you're referring to the programming language, I am not the right assistant for that. However, if you're asking about the breast cancer research, might be used programming language Python, I can tell you some researches for Python, this. And apart from that, using Python, I can try to help. So as I told you in my previous part, that if you ask something out of the context which is not related to any medical history, this AI assistant will not allow that. Simply it will not generate anything, right? This kind of message it will generate and you will find this. Okay, so this is the speciality of my AI assistant part, I can say AI. So let's clear chat. Okay, so moving on to the next module, this is reports part. See, as I told you, so you can download the CSV file or the Excel file. In this format only, you will get your Excel file. Let's say 3 patients have already been registered with their different IDs, right? You can see here. So this type of thing here you will find, see, right? This thing you will find in the Excel sheet or you can CSV file. So both are here. You can download any one of that. I am giving you just a demo. Let's say I'm clicking on this Excel file. So see, it has opened here. Now you can check. Wait for some time. Yeah. See, this is the Excel file. And CSV file is also like that only. It is same as Excel CSV file. So I'm not going for that because it is same. CSV will also generate the same Excel file only. So I'm not going with that, right? Now moving on to our next module. So this was all about the hospital reports. That is the record or the data set page. Let's say someone wants to gain access to the data, right? And this is the about part. So this is about my breast cancer management system, that is AI powered breast cancer management system developed to assist hospital doctors, researchers and healthcare professionals in managing breast cancer patiently. So this was my project information. What thing I have used, you can see here, the version, the type, the database, the front end, the programming language, assistant, chats, reports, and the technologies that I have used: Python, Streamlit, SQLite, Pandas, Plotly, OpenExcel, ReportLab, Grok AI, Llama. And this is all about my profile, that is the developer part. So I am from the mechanical engineering part. So this was my project, and the purpose for making this project was research and healthcare, right? So these are my whole work, you can see here, right, from the developer side. Okay, so moving on to the next part. So yeah, this is a help desk. Let's say someone who doesn't know where to register patient or what to do, what not to do, they can refer this. Let's say someone who is very new or unknown, he doesn't know anything. So this is the help desk, help center. They can see my user guide, register patient. These are written here, how to search for a patient. This is the dashboard. And apart from that, this is the AI assistant and frequently asked question FAQ. You can see here, it is there. And this is the AI assistant part, and this is the reports part, right? Apart from this, the technical support, obviously if someone faces some kind of problem, they can contact me. So basically I have given my details, but you can give give anyone who might you like, but whatever, actually I am the developer of this web application, so that's why I've given this my email ID and phone number and the supporting hours, right? But if you are making something, it's up to you whether you want to give it or not. This can be random also, there is no issue in that. But whatever I have made on my own, so that's why I have given my this thing. You can give a random contact number or email ID also, there is no issue in that. Okay. And the last part or the last portion is your this contact number. See, I have, as I have already told you, that you can use random name, but I have not used any random name because this project is basically a prototype or a model, right? It is not officially, I can say, a licensed part of any hospital, so I have not given any hospital's name. I have just given a random name and the address. And yeah, you can find my email ID and phone number and the random website I have given here. And this is the emergency contact number, random I have given here. This is the working hour. So it is totally all clustered and formed as per the hospital's protocol, as per hospital's model or domain or type, you can see, right? So you can see these are the working hours. And yeah, let's say if someone wants to find, doesn't know where to go, they can type the address as it is given here, the name and address of the hospital in this location bar, and they can click and they can paste the location there. They will get the exact location and the address from there. They can use this data, hospital name and address, and they can click on this maps google dot part. They will get the information of the about the hospital. Okay, so this was all about my this whole work which I did, right? So here I will click on logout. So you can see it's logout. And one new special feature I have added in this part, that is the retrieval data, that is RAG, retrieval augmented generation, RAG. Now what is it is all about? Okay, wait. See, now why I have done this, there is a reason behind that. So I am opening the database, right? So this is the database part, this is the breast cancer part. I am opening here. So you can see browse data, it is already given here, right? You can already see here. So here patient ID, everything is there. We haven't updated the name in that, right? So let's first update it, then it will show here. So wait a second, I am logging in once again, right? Yeah, so I am going to the patient details part. So I have gone in the search patient details, right? I have given this. So yeah, this patient was not updated, so let's update this. Yeah, it's being updated, right? So let's go for logout, and you will see here Wait. So I can see here everything is shown, right? The disease and all everything. Okay. Now why I created this, let's say if the website gets crashed or something like that, or emergency thing happens, so this is one kind of a backup. You can say that if someone wants the data immediately, they can access the data from here, right? Let's say if the website crashes, nothing works well, immediately they want the data, they are not getting it from everywhere. So this will be the portion where they can access the data, retrieve the data, right? And the data will be secured with the required hospital personnel only. Nobody can access that, right? So this is all about the thing. Okay, so you can go for your this, I can say, let's say P 005. Let's enter this. I think it has not taken the name. Okay, no issue in that. But this kind of thing we will see here, right? This kind of thing you will see here. Okay. And why I have created this, there is a reason behind that, as I already told you. So this was all about my project, right? And my main motto is also for making this project was Atmanirbhar Bharat. That is, whatever database or whatever will be the things will be there, it will be there inside our country India only. We will not use any uh, another server like Google or something like that. It will be an indigenous server, and everything will be within us and within ourselves, fully secured. So this one thing I thought and created this backup or the retrieval rack part, right? So this is one, I can say, a step towards the Atmanirbhar Bharat. That's all. So thank you all. Thank you very much.